The Prime Minister just said that it would be months and months before a vaccine is available in Canada, so we need to use other tools right now. Yesterday, Anthony Fauci said that Canada must test widely in the community for asymptomatic spreaders in order to stop the spread of COVID. To do this, we need things like at-home tests that people can easily buy and frequently use. And today, the U.S. approved this type of test. When will the Prime Minister allow Canadians to have this life-saving and job-saving tool?
Honourable Prime Minister.
Mr. Speaker, $25 billion. That is what we've spent, we've sent to the provinces so they can invest in testing, in contact tracing. We sent that over the summer for vulnerable people, for back to school, to support their health systems. We understand how important it is for the federal government to be there to support Canadians directly and to support the provinces. And I certainly look forward to continuing to work with the provinces on delivering these tests that they need. We delivered rapid testing to all the provinces, and hopefully soon some of the provinces will start deploying those rapid tests that we've delivered to them by the millions.
Well, member for Calgary, Nose Hill.
Mr. Speaker, just to remind the Prime Minister, it's actually his job to approve technologies like at-home tests, which the Americans just approved today. And he might not realize in his rich privilege that people might not be getting tested because of the stigma. If we could have at-home tests that people could use in the privacy of their home frequently, it could be a game changer. It could keep things open. It could keep kids in schools. When will the Prime Minister stop blocking Canadians from having access to at-home tests?
Honourable Prime Minister.
Mr. Speaker, it concerns me that in the middle of a pandemic where health is on everyone's mind, the opposition health critic does not understand that it is not my job to approve tests. It is not the job of the Prime Minister or any politicians to approve tests. It is the job of our professional, independent public servants who we trust to make those jobs. Maybe she thinks it's all about politics. It's not. It's about protecting Canadians and saving lives, and that is what has guided this government every step of the way in this pandemic. Science, not politics, Mr. Speaker.
Well, member for Calgary, Nose Hill.
Understand, Mr. Speaker, is that it's his job to go to the bureaucracy and say, we need both. We need rapid test review. We need to have that sanctity and that thoroughness of review, but we need to have it quickly so that we can save lives. At-home tests should be something that the government is encouraging Health Canada to do a fulsome review in a short period of time so that we can have access to these tests and stop the pandemic in its tracks. That is his job, and it's his lack of ability to get this done that's preventing Canadians from having access to these tools. Why?
Right Honourable Prime Minister.
Mr. Speaker, every step of the way, this government has worked closely with scientists, with health professionals to ensure that they have the tools to do their jobs, that they can make the best recommendations possible to Canadians. And we have amplified those and ensured that Canadians right across the country, from public health officials to premiers, can make the right decisions to keep people safe. We've said to them, I know you're going to face difficult decisions about whether to shut down quickly or try and stretch it out a little. Well, we've made that job slightly easier by saying we will have your citizens' backs. We will have the businesses' backs. We will give those supports so you can make the decision to shut down quickly. That is what we've been there to do for the provinces, and we will continue to be there to support all Canadians.
The Honourable Leader of the Opposition.
What concerns me, Mr. Speaker, is the arrogance of this Prime Minister. We ask questions hoping for a better response from this government. Science above politics, Mr. Speaker. A year ago, they shut down the early warning pandemic system to focus on vaping, a system that for 20 years protected Canada from an outbreak like this. For 20 years, scientists were tasked to rely on their own intelligence, not on China, Mr. Speaker. So, excuse me, Mr. Speaker, if we're bothering the Prime Minister with these questions, we want to save lives, we want to save our economy.
The Right Honourable Prime Minister.
I am sure that I didn't just hear the Leader of the Opposition say that because of something we did last year, Canadians are now facing a pandemic. The level of political attacks there that they're actually tossing out is irresponsible in a time where Canadians are looking to government and to political leaders to pull together. And that's exactly what we've done. We have been working hand in glove with the provincial governments. We've been working with local health authorities. We've been ensuring that Indigenous communities get the supports they need. We've been working directly with Canadians. We will continue to have Canadians' backs every step of the way.